Hi, my name's Ed Shanshala. I'm the CEO of Ammonoosuc Community Health Services. At ACHS, we provide primary preventive health care. We do so that each of us can stay healthy. Why each of us stay healthy is a very personal and unique story. The following is a personal and unique story of one of our friends, families, or neighbors and why they stay healthy.
So when Courtney was diagnosed with cancer, I was like, well, cancer is not unknown to my family. This is not great, but I was trying to be as positive as I could. And because she is who she is and is a great advocate, and her brother's in the healthcare, and her mom and dad have some healthcare background, I felt like this is going to be okay. I can take their lead and we'll learn about it as we go. I said, I've tried to attend as many of her appointments as possible. I said, most importantly for her, but I said also to be able to be there for the people who don't have someone, because the amount of people I saw going into the cancer center or to their appointments without a loved one or an advocate, it was just sad. The time it became complicated was obviously during COVID, when there were times when I wasn't allowed to go in, but it was more of, so when they were speaking to her as the patient, I was there listening, and if there were questions that she asked, and maybe there was a follow-up from that, I could ask it, or I could say, knowing kind of some of her habits, that she's a really good caregiver for other people, and I'd like to see her put that effort into herself. What can we do to do that? But I don't believe anyone ever said, as a caregiver, here's what I see your role, here's what I'd like you to do, or I'd like to talk to you. It was a little overwhelming, given that, we had one doctor here, and then we had another doctor here, and oh, hey, we're going to New York City, now we're going to Dartmouth. But once I got over that part of it being really overwhelming and trying to keep track of who was where and who are we seeing for why, it was well, this is what we need to do, right? Because there are people who are specialists. I mean, it's really hard to, to be the generalist. I think it's one of those things is first acknowledging how they're feeling and validating that, but also it's okay to show. I think showing your parents, showing your brother or sister how you feel, asking the questions, asking them what do they need. If you need clarity on something, it's okay. We don't know everything, so if you need something, you have to communicate it, because you're the only one that's going to know that. And so I think that's important in knowing what are my limits. I think it's more of the mental health care piece I think is important for me. As a school counselor, that's a lot of what we talk about. And I also think, yeah, you have the physicalities of an illness, but I also think sometimes, or a lot of times actually, the mental health wraparound is missing. All of the counselors and therapists, it's hard to get in. And, even if you're going through the diagnosis, or you're the caregiver of, or you're the family member, that piece is really important to, clear your mind, to have that connection, to have that resource. And I feel that's the piece that's that's missing. So just being able to listen, if something's not right with your body, it doesn't feel right to you, kind of responding to that, asking the questions, and just really, okay, so at any given moment, you don't know what's going to happen, and really trying to take those steps to be as cautious as you can and just bring awareness. I think that's one of the biggest things, is trying to, bring awareness, to be supportive of anyone and everyone who might be on this journey.